About 750,000 total hip replacements are performed in the U.S. each year. Those CDC numbers indicate surgeries done in a hospital, where the patient will stay for days after the procedure. Reno Orthopedic Clinic's changing the way hip replacements are done in northern Nevada. They let me in the operating room for our region's first outpatient hip replacement.
Large, 3178.
Reno resident Dave Fish is pretty rough on his body. As the owner of Eclipse Pizza, he's on his feet all day long.
It's a busy environment. I'm standing up, I'm chatting, I'm running pizza, I'm making pizza, I'm glad handing customers, taking care of business, and it's a fun environment, but it takes a little hustle.
And on his downtime, Dave coaches masters swimming and competes in some of the most elite endurance races.
21 Ironman triathlons, a lot of running, a lot of biking, a lot of skiing, a lot of hiking, so it's taken its toll over the years.
The day before his hip replacement, Dave ran 5 miles and then worked until closing.
At the end of the night in bed, it just hurts, After a long day working or standing up or doing whatever, it's just a constant pain.
You can see in his case that he's completely worn out this space. The bone is actually digging into the bone, so it's almost like a rectangle in a circle trying to move.
Harvard-trained orthopedic surgeon Jackson Jones performs these surgeries differently than the current norm, from the front of the hip joint instead of alongside the hip.
The other approaches require that you cut through muscle to get down into the hip. With the anterior approach, we don't have to cut any muscle. We can go in between a couple of different muscle planes, and when people don't have muscle to heal, you're not worried about attachments of muscle on the bone. They get up moving faster.
So fast,
He'll be walking out the door today.
a hospital stay is becoming unnecessary for the healthiest patients.
You get them up faster, you get them home, which everyone wants to be home, but more importantly, infection rates are lower when you're not in hospital. It's a little more comfortable setting. And if you're home, you're actually safer than if you're in the hospital.
The surgery itself took Jones and his team about an hour and a half. The bad ball and socket replaced with titanium and polyethylene parts.
There's plenty of muscle in there, so I expect some stiffness.
Yeah.
2 hours after being wheeled into recovery.
I'm standing.
45 minutes after that,
Now you want to rest?
Dave went up and back down a flight of stairs.
Doesn't hurt at all. Just that IT band is tight.
Amazing the therapists and Rock Surgery Center staff.
The more you walk, the better off it'll be.
Just 5 hours after his total hip replacement, Dave is wheeled out and headed home.
You used a walking stick or anything along those lines?
I did, but I don't anymore.
At his 2-week checkup,
Every day it gets just a little bit better.
Dave is already riding a recumbent bike for a half hour.
In terms of activity level is just let pain be your guide. The sky's the limit. You can go as big as you want to go, but do it in small increments. So.
Sure, yeah.
4 weeks after his total hip replacement, Dave is back at work. He does have a bench in case he gets tired.
The actual pain from the hip is less now. It's virtually gone.
But this athlete is cycling and swimming again and looks forward to doing a whole lot more on his bionic hip. Dr. Jones says patients go through screening before he'll consider doing the total hip replacement at the Rock Surgery Center. Higher risk patients, of course, do not qualify. But getting the procedure in the surgery center is much cheaper for insurance. I'm told it can be about 1/3 the cost. We purposely didn't include video of the surgery itself in this story for broadcast, but an extended version can be found on colotv.com.